Thank you everyone for joining this presentation. My name is Lisa Marie Gomez and I am with CMS and I will be reviewing the quality performance category. Next slide, please. This is a disclaimer slide, just highlighting that with any information that we are providing today, it's just an overview, but if you want information specifically relating to the actual policies and regulations, we ask that you refer to our regulations for further information. Next slide, please. Today's topics will include an introduction, an overview of the quality performance category, which will include the basics for the quality performance category, updates in 2024, participation in MIPS, and then also in regard to reporting and scoring. And then the last item I'm going to discuss relates to the help and support resources that are available. Next slide, please. Now I'm going to provide an overview and give a general introduction for the program. Next slide, please. So this webinar is an overview of participation requirements in the quality performance category for the 2022 performance year. I just want to highlight that the overview webinar will be posted on the QPP webinar library and it will be accessible to you. Next slide, please. Now I'm going to discuss the MIPS reporting timeline. The first item that I'm going to discuss relates to the performance year. The performance year is from January 1st, 2024 through December 31st, 2024. To submit your data, the timeline is different. It's actually in 2025. So this timeline to submit your 2024 data is from January 2nd, 2025 through March 31st, 2025. Now I'm going to discuss when the feedback is available for 2024. So the feedback will be available in 2025, which is usually around this summer. Now, payment adjustments. So for your 2024 performance period or performance year, your payment adjustment will be made available for the 2026 payment year. Next slide, please. Now I'm going to discuss eligibility, specifically MIPS eligibility. So for those that are eligible to participate in MIPS, you will be scored on 4 performance categories. Those performance categories are quality, improvement activities, promoting interoperability, and cost. For quality and improvement activities and promoting interoperability performance categories, those are the performance categories that you are required to submit data for. For the cost performance category, CMS collects and calculates data for you, so you don't have to do anything for that performance category. I just want to note that a final score from its participation includes those 4 performance categories, and your score is relative to 0 to 100 points. So depending on your performance, you will receive 0 to 100 points. I just want to note in regard to payment adjustments that the MIPS final score determines whether you receive a negative, neutral, or positive MIPS payment adjustment. And the payment adjustment is based on performance during the 2024 performance year, and and apply to payments for Medicare Part B covered professional services starting January 1, 2026. And that's what I noted previously, that your assessment for 2024, your payment adjustment will be applied in 2026. So it'll be starting with January 1, 2026. Next slide, please. So the next reporting options for 2024. There are 3 reporting options. The first reporting option is traditional MIPS. The second option is MIPS Value Pathways, also known as MVP. The third reporting option is the APM Performance Pathway, also known as the APP. And I'm going to discuss traditional MIPS. For traditional MIPS, this is considered the original MIPS reporting option. This is where you select quality measures and improvement activities from the complete MIPS inventory. Clinicians are automatically evaluated and can be scored on up to 4 administrative claims measures. And for under traditional MIPS, you report the complete promoting interoperability measure set. And as I noted previously, you will automatically be calculated on the cost performance category, which means any cost measures that are applicable to your particular practice. Now I'm going to discuss MIPS Value Pathways, again, also known as MVPs. So MVPs are the newest reporting option that's available, and this allows you to also meet the MIPS reporting requirements. With the MIPS Value or the MVPs, it offers a more meaningful grouping of measures and activities to provide a more connected assessment of the quality of care. So once you register for an MVP, you're able to select the quality measures and improvement activities available within your MVP. And within your MVP, you're required to report and complete promoting interoperability measure sets. And similar to traditional MIPS, you will automatically be calculated on cost measures within the MVP. Now I'm going to discuss the APM performance pathway, also known as the APP. So the APP is a streamlined reporting option with a predefined measure set and is only available to MIPS APM participants. The APP is designed to reduce reporting burden and encourage participation in APMs. MIPS APM participants currently receive full credit for the improvement activities performance category, though this is evaluated on an annual basis. Just want to know you also need to report the complete promoting interoperability measure set, and cost isn't evaluated under the APP. Next slide, please. Now I'm going to discuss the basics of the quality performance category. Next slide, please. Now I'm going to provide an overview. The quality performance category assesses the quality of care clinicians deliver as evidenced by their performance on the quality measures. Quality measures are a tool to help CMS to measure healthcare processes, outcomes, and patient care experiences. So here you can see a list of what we categorize our measures. So our measures can be classified as behavioral health measures, chronic condition measures, safety measures, patient-centered care measures, affordability and efficiency measures, equity measures, wellness and prevention measures, and seamless care coordination measures. So as you assess the measures within the traditional MIPS measure inventory, which is the full measure inventory, or within your MVP, you will see that the measures meet these domains or these categories of measures. Next slide, please. Now I'm going to discuss the quality measure inventory updates for 2024. And the updates are highlighted and based on the 2024 Physician Fee Schedule Final Rule. So for 2024, there are a total of 198 quality measures. I want to note that 3 of those 198 measures are considered partially removed measures, meaning that the measure is not available for traditional MIPS, but available for MVP utilization only. I also want to note that for 2024, there's an addition of 11 quality measures, including 1 composite measure and 6 high priority measures. Also for 2024, there is a removal of 11 quality measures. And I want to note with regard to substantive changes. So on an annual basis, we do update measures. And for our inventory, there are 59 measures that have substantive changes. All of those substantive changes are highlighted in the 2024 Physician Fee Schedule Final Rule, but also available in the measure specifications that are updated on an annual basis. I also want to note that with regard to just another item for 2024 relates to the data completeness threshold, and that was increased to 75%. So measures are evaluated based on the data completeness threshold of 75%. Next slide, please. Also, as a continuation of the quality measure inventory update, below is an overview of 7 types of quality measures you may report for the quality performance category. So you will see that there is an inclusion of process measures, outcome measures, intermediate outcome measures, patient-reported outcome-based performance measures, structure measures, patient engagement / experience measures, and efficiency measures. Next slide, please. Now I'm going to discuss the quality basics for 2024 as it pertains to traditional MIPS. So for quality counts for 30% of your MIPS final score. The quality performance category is weighted at 55% for MIPS eligible clinicians participating as an APM entity. The performance period for the quality performance category is 12 months. And as previously noted, there's a total of 198 quality measures that are available to you. And for traditional MIPS, you're required to select a minimum of 6 individual measures or report 1 complete specialty measure set. 1 measure must be an outcome measure or a high priority measure if an outcome measure isn't available. And high priority measures are categorized into the following 8 categories: outcome, appropriate use, patient engagement / experience, patient safety, efficiency care coordination, opioid related, and health equity related. If there are less than 6 measures that apply to you, you should report on all measures that are applicable to you. Similar with regard to your reporting a specialty measure set. If there are less than 6 measures within that specialty set, you're required to report on all measures in that specialty set. Next slide, please. So now I'm going to continue highlighting measures that are available under traditional MIPS. So in addition to the 198 quality measure inventory, there are also qualified clinical data registry measures, also known as QCDR measures. There are 212 QCDR measures available to you that you're able to select from. And again, this could be one of the 6 required measures that you would be required to select. Next slide, please. I just want to highlight that with regard to 2024, the CMS Web interface is no longer available as a collection or submission type for groups, virtual groups, and APM entities participating in traditional MIPS. However, 2024 is the last performance year that the CMS Web interface is available for Medicare Shared Savings Program accountable care organizations. I just want to note that the Shared Savings Program accountable care organizations have historically reported MIPS quality measures through the web interface, and we have been encouraging those ACOs to start preparing to transition to a new collection type, because as I noted, the CMS Web interface, the last year that it's available is for the 2024 performance period. Next slide, please. Then we're going to go over the basics for MVPs relative to 2024. So as a reminder, in order to report measures or participate in MVP, you must register in advance to report an MVP. 30% of your MIPS final score is comprised by the quality performance category. The quality performance category is weighted at 55% for MIPS eligible clinicians participating as an APM entity. The performance period for the quality performance category under an MVP is 12 months. There are a total of 16 MVPs. I want to note that MVPs are optional, but will become required in the future. You may report a clinically relevant MVP instead of traditional MIPS. Next slide, please. So under an MVP, you're required to select 4 measures from those available in your selected MVP. I just want to note that foundational layer measures do not count towards the 4 selected quality measures. You must one measure must be an outcome measure or a high priority measure if an outcome measure is not available. High priority measures are categorized into the following 8 categories: outcome, appropriate use, patient engagement experience, patient safety, efficiency, care coordination, opioid-related, and health equity-related. Population health measures are scored as part of the quality performance category, and small practices reporting Medicare Part B claims measures will meet quality reporting requirements by reporting all of the Medicare Part B claims measures available in the MVP, even if there are fewer than 4 measures. Next slide, please. Now I'm going to discuss quality measure scoring. The measures that can be reliably scored against the benchmark will receive 1 to 10 points. I just want to highlight that in regard to new measures, the scoring floor is a little bit different. So for measures in their first year of their program, they will receive a 7-point scoring floor. For new measures that are in their second year of the program, there is a 5-point scoring floor. The measures without a benchmark will receive 0 points in traditional MIPS and MVPs, even when the data completeness and case minimum criteria are met. I just want to note that for small practices, when there is a measure without a benchmark, there is a 3-point floor. So measures that do not meet the case minimum criteria will receive 0 points. Again, this particular policy is not applicable to small practices. Small practices will receive 3 points. Measures that don't meet the data completeness criteria will continue to earn 0 points. Again, this policy is not applicable to small practices. Small practices will receive 3 points. I just want to give you a reminder for 2024. CMS now scores administrative claim measures exclusively against performance period benchmarks. Next slide, please. Now I'm going to discuss achievement and bonus points. So for the first item, achievement points, measures can be earned between 0 and 10 achievement points based on performance in comparison to a benchmark and the volume of data reported. With regard to bonus points, small practices are the only practices that receive bonus points. So for traditional MIPS, MVPs, and the APP, CMS will continue to add 6 bonus points to the quality performance category as long as 1 quality measure is submitted. I just want to note that CMS no longer awards bonus points for reporting additional outcome and high priority measures beyond the 1 required, and reporting measures that meet electronic end-to-end reporting criteria. So those are the 2 bonus points that are no longer available under MIPS. Next slide, please. Now I'm going to discuss the reporting requirements for 2024, specifically for the quality performance category. Next slide, please. Now I want to go over collection types. So collection type is the way clinicians collect data for a MIPS quality measure. A MIPS quality measure may be collected in multiple ways, but each collection type has its own specific instructions for reporting. The collection type used has implications for scoring, and there are 5 collection types or ways you can collect and submit your quality measure data to CMS. The collection types include ECQMs, MIPS CQMs, QCDR measures, Medicare Part B claims measures, and the CAHPS for MIPS survey measure. So again, there are 5 collection types, and they're highlighted on this slide. Next slide, please. Now I'm going to discuss data completeness. Data completeness refers to the volume of performance data reported for the quality measure's eligible population. So data completeness is specific to Medicare patients for Medicare Part B claims measures only. So for QCR measures, MIPS CQMs, ACQMs, data completeness relates to all payer data. When reporting a quality measure, your submission must identify the eligible population or denominator as outlined in the measure specification. For small practices reporting Medicare Part B claims measures, CMS identifies the eligible population based on the claims you submit. To meet data completeness criteria, you must report performance data, which is the performance met or not met, numerator exclusions or denominator exceptions, for at least 75% of the total eligible population, excluding denominator exceptions. Next slide, please. Now I'm going to continue with data completeness threshold. For 2024, the data completeness thresholds are 75% for data submitted on QCR measures, MIPS CQMs, and ECQMs. Again, these are all payer data. The data completeness threshold is also 75% for data submitted on Medicare Part B claims measures, or Part B claims data. I want to note that the data completeness threshold will remain at 75% for the 2025 and 2026 performance periods. Quality measures that don't meet the data completeness threshold earn 0 points. Again, small practices will receive 3 points for measures that don't meet the data completeness threshold criteria. Next slide, please. Now I'm going to discuss administrative claims measures. There are 4 MIPS quality measures that will be automatically evaluated and calculated through administrative claims and traditional MIPS if minimum requirements are met. So the following are the 4 administrative claims measures: risk standardized acute cardiovascular related hospital admissions rate for patients with heart failure under MIPS, clinician and clinician group risk standardized hospital admission rates for patients with multiple chronic conditions, hospital-wide 30-day all-cause unplanned readmissions rates for MIPS groups, risk standardized completion rate following elective primary, total hip arthroplasty, and or total knee arthroplasty for MIPS. Next slide, please. I'm going to discuss population health measures. There are 2 population health measures that are available in MVPs. You must select your preferred measure during MVP registration. So the population health measures include the clinician and clinician group risk standardized hospital admission rates for patients with multiple chronic conditions, and hospital-wide 30-day all-cause unplanned readmission rates for MIPS groups. CMS evaluates you on the population health measures included in your registration using administrative claims data. If you don't meet the minimum requirements for that measure, we'll attempt to score you on the other population health measure that's available. If you can't be scored on either population health measure, the measures will be excluded from scoring. Next slide, please. So submitting quality data. This slide outlines the different elements relating to submitting quality data. So submitter type is who, which is you, a third-party intermediary, or CMS-approved survey vendor. The collection type, which is the what. Again, the collection types include Medicare Part B claims measures, ECQMs, MIPS CQMs, and the CAHPS for MIPS survey measure. So submission type, which is the how. So through your routine Medicare Part B claims billing practices, you can also sign into the Quality Payment Program website and upload a QRDA3 file or a QPP JSON file. And I just want to note that when you're, let's say, reporting the CAHPS for MIPS survey measure, it's through a secure method outside of the Quality Payment Program website. Now, in relation to submission period, that's when. As I previously noted, the 2024 data that you will be submitting will be submitted in 2025, specifically January 2nd through March 31st, 2025. And so this slide just outlines just a general summary of the who, what, when, and how. Next slide, please. Now I'm going to discuss the scoring for the quality performance category. Next slide, please. So now I'm going to discuss the achievement points that are available. So there are 1 to 10 achievement points available for measures in their third year or beyond based on your performance in comparison to a benchmark. If the measure meets the data completeness threshold criteria, that the measure has a benchmark, and the case minimum is met. There are also 7 to 10 achievement points for measures in their first year of the program. So between 7 and 10 achievement points are available if the measure can be reliably scored against a benchmark. And if a benchmark exists and the measure meets the data completeness threshold and case minimum requirements are met. So the quality measure will earn 7 points if the measure meets the data completeness requirement but does not have a benchmark or meet the case minimum requirements. I'm going to discuss 5 to 10 points, and this is specific to measures in their second year of the program. So for measures in their second year of the program, the achievement points that are available are 5 to 10. So there are 5 to 10 achievement points available if the measure can be reliably scored against the benchmark. So this means that a benchmark exists and the measure meets the data completeness and case minimum requirements. The quality measure will earn 5 points if the measure meets the data completeness threshold requirements but does not have a benchmark or meet the case minimum requirements. So measure that receives 0 points. So 0 achievement points will be awarded if your quality measure doesn't have a benchmark. So 0 achievement points will also be applied if your quality measure doesn't meet data completeness requirements, which varies by collection type. And I also just want to note that 0 achievement points will also be given if the case minimum requirement is not met. Again, I just want to highlight that small practices, the 0 achievement point policy does not apply to small practices. Small practices will receive 3 points for the above items. So again, they will receive 3 points if a measure does not have a benchmark, if a measure does not meet data completeness, or if a measure does not meet case minimum requirements. Next slide, please. Now I'm going to discuss top-down quality measures. So on an annual basis, CMS identifies top-down measures through our benchmarking process. Measures that are topped out for 4 consecutive years can be proposed for removal through rulemaking. I just want to note that it doesn't necessarily mean that once a measure is topped out for 4 consecutive years, that it will automatically be proposed for removal. So it's just something that we consider for our measures, particularly, for example, if there are measures that are in specialty sets and there are very few measures in the specialty sets, we may not remove a topped-out measure for that reason. So that's why it's not always a guarantee that a topped-out measure for 4 consecutive years will be proposed for removal. So the process measures are considered topped out if the median performance rate is 95% or higher. This is for non-inverse measures, or 5% or lower for inverse measures. For non-process measures are considered topped out if the level of variance is less than 0.10 and the 75th and 90th percentiles are within 2 standard errors. Next slide, please. So I'm going to continue with topped-out quality measures. A measure is considered extremely topped out if the average performance rate is 98% or higher for non-inverse measures, or 2% or lower for inverse measures. I just want to note that CMS will consider extremely topped out measures for removal in the next rulemaking cycle, even if it's in the midst of a topped out measure cycle, but they may be retained in certain cases. I just want to note that there is a 7-point cap. A measure is capped at 7 points when it's topped out through the same collection type for 2 consecutive years. The 7-point cap is applied in the second consecutive year the measure is identified as topped out. Next slide, please. I'm going to discuss benchmarks. Each MIPS quality measure is assessed against its benchmark to determine how many points the measure earns. CMS establishes benchmarks specific to each collection type. Whenever possible, CMS uses historical data to establish benchmarks. 2024 historical benchmarks for ECQM, MIPS CQM, Medicare Part B claims measures, and QCR measures are based on actual performance data that was submitted to QPP for the 2022 performance period. If a quality measure doesn't have a historical benchmark for any of the collection types, CMS will attempt to calculate a performance period benchmark based on data submitted for the 2024 performance period. Just want to note that beginning with the 2023 performance period, CMS has started scoring administrative claims measures exclusively against performance period benchmarks. Next slide, please. Now I'm going to discuss flat benchmarks. For measures with a benchmark that may cause inappropriate or overuse of treatment, CMS will set those benchmarks using a flat percentage for all collection types where the top decile is greater than 90%. For the 2024 performance period, the following measures/collection types met the criteria set by policy to establish flat benchmarks. So measures 0001, diabetes, hemoglobin A1C, poor control, and that's the MIPS CQM collection type that is only applicable. So the other measure is measure 236, controlling high blood pressure, and the collection types that are applicable, the MIPS CQM and the Medicare Part B claims. Next slide, please. So benchmarks relative to the CAHPS for MIPS survey measure. CMS attempts to establish a benchmark for each summary survey measure in the CAHPS for MIPS survey measure. For the 2024 performance period, these benchmarks were calculated using historical data from the 2022 performance period. Each summary survey measure with a historical benchmark is awarded 1 to 10 points by comparing performance to the benchmark. So this is similar to other measures. The final CAHPS for MIPS survey measure score will be the average number of points across all scored summary survey measures. Next slide, please. So now I'm going to discuss how benchmarks are converted to achievement points. So on this slide, in this graphic, we're going to go through it to see how benchmarks are converted to achievement points. So the question we ask, does the measure meet data completeness criteria? If no, there are 0 achievement points awarded or 3 achievement points awarded for small practices. If a measure does meet data completeness, then the next question we ask, does a measure meet case minimum? If the measure does not meet case minimum, there are 0 achievement points, but there are 3 achievement points for small practices. And I just want to note that for new measures in the program, there are achievement points. So for the first year a new measure is in the program, they receive 7 points. And if the new measure is in its second year in the program, it receives 5 achievement points. So if a measure does meet the case minimum criteria, the next question that we ask, is there a benchmark available? If there is not a benchmark available, 0 achievement points are applied, or 3 achievement points are applied for small practices. And again, I just want to note that for a benchmark, if the benchmark is not available, there are 5 to 7 achievement points available for new measures in the program. And again, it'll be either 5 or 7 if they are either in their first or second year of the program. And again, that's if there are not any benchmarks. And then the next question that we ask, like once there, if we know if there is a benchmark available or not, is, okay, do we look at the criteria that we just discussed? And based on that criteria, there will be 1 to 7 achievement points available based on a measure for the quality performance category. Next slide, please. Now I'm going to discuss if, let's say, your practice chooses a measure that doesn't have a historical benchmark. So as I previously highlighted, so starting with the 2023 performance period, quality measures that cannot be reliably scored against a benchmark or quality measures without a historical benchmark will receive 0 achievement points unless performance period benchmark can be established. Again, I just want to highlight a few items that I've previously discussed a few times, but we just want to emphasize these points. The small practices will still receive 3 achievement points. If a measure is in its first or second year of the program, these measures will earn 7 to 5 points respectively. This applies to measures in traditional MIPS and MVPs across all collection types except for administrative claim measures. It doesn't apply to participants in the APP. So if the measure doesn't also meet the data completeness requirements, it will receive 0 achievement points. So except for small practices, again, they will receive 3 achievement points for measures that do not meet the data completeness requirements. Next slide, please. Okay. Now I'm going to discuss improvement scoring. For the 2024 performance year, you can earn up to 10 percentage points based on the rate of your improvement in the quality performance category from the previous performance year. Improvement scoring is calculated by comparing the quality achievement percentage score from the previous performance period, which would be 2023, to the quality performance category achievement points scored for the current, which is the 2024 performance period. Measure bonus points are included in improvement scoring. So this is the formula for improvement scoring, which is the numerator is increase in the quality performance category achievement score, and the denominator is prior performance period quality performance category achievement score. So the numerator and denominator are multiplied by 10%, and that will give you your improvement score. Next slide, please. Now I'm going to discuss calculating the quality performance category score. The quality performance category score is a product of the following equation. So the numerator is the total measure achievement points, and the denominator is the total available measure achievement points. So the numerator and denominator is multiplied by 100%. So once you calculate that, then you add the improvement score, which will be the quality performance category score. So as an example, on this slide, you will see that the numerator is 48, which is the total measure achievement points, and the denominator, which is 60, which is the total available measure achievement points. When you multiply the numerator and denominator by 100, and then you add, let's say, the improvement score of 1.9%, your total quality performance category score is 81.9. Next slide, please. Now I'm going to discuss the maximum points available in the quality performance category. So maximum quality points available in traditional MIPS when submitting an ECQM, Medicare Part B claims measures, MIPS CQMs, and QCR measures. So on the right-hand side of this table, you will see maximum points. And then in the middle column, you will see who it's available to. And then in the last column, which is on the right, which is, what the points are scored on. So now I'm going to go through this individually, the different maximum points that are available. So if, let's say, you are scored on 6 measures and there are 0 administrative claim measures available, the total maximum achievement points that are available to you are 60. And these 60 points are available to individuals, groups, virtual groups, and APM entities. So let's say you're scored on 6 measures plus 1 administrative claims measure. The available maximum points that are available are 70 points. And again, these points are available to individuals, groups, virtual groups, and APM entities. Let's say you are scored on 6 measures and 2 administrative claims measures. The total maximum points available are 80 points. These points are available to individuals, groups, virtual groups, and APM entities. Let's say you're scored on 6 measures plus 3 administrative claims measures. The total maximum points available are 90 points. This is available to groups, virtual groups, and APM entities. Let's say you are scored on 6 required measures and 4 administrative claims measures. The maximum points available are 100 points, and this is available to groups, virtual groups, and APM entities. Next slide, please. So now I'm going to discuss maximum achievement points available in the quality performance category in relation to an MVP. So again, this is in relation to submitting an ECQM, a Medicare Part B claims measure, a MIPS CQM, and a QCR measure. So in this table, you will see on the left-hand side, which is the left column, maximum points. In the middle, it's who these points are available to. And on the right-hand side, which is the right column, this relates to, who is being scored on what. So for the first example, if let's say you are being scored on 4 required measures and there are 0 population health measures, the total maximum achievement points that are available are 40 points. And this is available to individuals, groups, subgroups, and APM entities. If let's say you're going to be scored on 4 required measures plus 1 population health measure, the total available maximum points are 50 points. And this is applicable to individuals, groups, subgroups, and APM entities. Next slide, please. Now I'm going to discuss the reweighting of the quality performance category. So if your quality performance category weight will be redistributed to other performance categories if data isn't submitted for the quality performance category because of the following issues. So the first issue relates to if there are no quality measures available to you, and this is only applicable for traditional MIPS, or you have an approved extreme and uncontrollable circumstances application for the quality performance category. When the quality performance category is weighed to 0%, the weight distributions for each performance category are outlined below, with the quality performance category weight being redistributed to the promoting interoperability performance category. So here you can see that when the quality performance category is redistributed or it's weighted at 0, it was added to the promoting interoperability. I just want to remind you that the quality performance category was weighted at 30%. So that 30% was added to the promoting interoperability performance category, which in this scenario is now at 55%. And you can see that the cost, which is at 30%, and improvement activities, which is at 15%, remains the same. Next slide, please. Now I'm going to discuss the help and support that are available to you. Next slide, please. Where you can go for help. You can contact the Quality Payment Program Service Center by emailing or creating a Service Center quality ticket. And I just want to note that you can, email, submit a ticket, or even call the Quality Payment Program Service Center to get answers to your questions. I also want to highlight that you can visit the Quality Payment Program website for other help and support information to learn more about MIPS and to check out the other resources available in the Quality Payment Program Resource Library. For small practices, visit the small practice page of the Quality Payment Program website, where you can sign up for the monthly QPP Small Practice newsletter and find resources and information relevant for small practices. Next slide, please. On this slide, this is a list of resources that are available to you. Again, we recommend and encourage you to review these resources to help you understand more information in regard to MIPS, whether it's traditional MIPS, MVPs, or the APM performance pathway. And these resources are available to you and provide really useful information as you report, whether it's for 2024 performance period or other performance periods. Next slide, please. I just want to thank you for joining this presentation today. And again, we appreciate all of your participation and efforts that you provide for the Quality Payment Program. Hope you have a good day. Thank you very much.